Good morning. Welcome back to Open Med School. I am Dr. Andrews, Professor of Medicine and Principal Pekedas Institute of Medical Sciences. Today I am going to discuss with you about pupillary light reflexes. What is this light reflex? When you throw light to the one eye, the pupil constricts. The constriction of the pupil on the same side is called direct reflex, and the constriction of the pupil on the other eye is called indirect or consensual reflex. So, light reflex has got two components, the direct and the indirect. So, here you can see the light is thrown to the right eye, the right pupil constricts, at the same time the left pupil should also constrict. This is the direct and consensual reflex. So, how will you do it? The most important thing is you should always stand on the side of the patient. This is to cancel the accommodation reflex, because during accommodation the pupil constricts. Accommodation reflex is much more powerful stimuli than the direct reflex. Second, you should throw the light from 25 to 30 centimeters away from the patient's side. Too close will produce discomfort to the patient. You can avoid light falling on the opposite eye by keeping your hand like this or a card near the nostril like this. So, this is how you, so the prerequisites are you should have good quality torch, you should stand on the right side, ask the patient to look at a distance and then throw light to one eye from 25 to 30 centimeters from the eye, and either the nostril should act as a shade for the other eye, or you can keep your hand or a card to avoid light falling on the other eye. We will just look into the anatomy and physiology of this pupillary light reflex. So, here you can see that suppose you take this is the pupil, surrounding the pupil there are circularly arranged muscles. These are the constrictor fibers, and there are radially arranged fibers, they are the dilator fibers. The constrictor fibers are under the influence of the parasympathetics coming through the third nerve, and the dilator pupillary muscles are under control of the sympathetics. So, this is a fundamental thing you should keep in mind. Dilatation is by sympathetics and constriction is by parasympathetics coming through the third nerve. So, this is a little more enlarged view. Here you can clearly see the circularly arranged muscles. Once it constricts, it produces pupillary constriction, and once the dilator muscles constrict, it will produce pupillary dilatation. Hope this point is clear to you. Now, we look into how this pupillary constriction occurs. Pupillary constriction is by the third nerve, that is the parasympathetic. The efferent is parasympathetic and the afferent is optic nerve. First, we will take the efferent. So, the parasympathetic outflow comes from the Edinger-Westphal nucleus. So, this is the Edinger-Westphal nucleus in the midbrain. From there, the fibers are passing through the third nerve. It goes and relay in the ciliary ganglion. So, here is the relay, and the postganglionic fibers go to the pupillary constrictor fibers, and that is how the pupil constricts. So, the efferent pathway is through the third nerve by the or from the Edinger-Westphal nucleus. The fibers relay in the ciliary ganglion, and from the ciliary ganglion through the short ciliary nerves it goes to the pupillary constrictive fibers. Now, we look at the afferents. The afferent is optic nerve. So, when the light is falling on the retina, the light is passing, you can see, come through the optic nerve, it goes to the chiasm, optic tract, and before it reaches the lateral geniculate body, it does not go to the lateral geniculate body, it goes to the pretectal region and relays in the pretectal nucleus. So, that is pretectal nucleus is in the midbrain, it relays in the pretectal nucleus. From the pretectal nucleus, you should see that it goes, innervation goes to both Edinger-Westphal nuclei. So, when the light is falling on one eye, both people should constrict. So, this is a very important point, that is the from the pretectal nuclei, the information goes to both Edinger-Westphal nucleus. So, this is how pupil constricts. The normal pupillary size is 3 to 5 millimeters. If it is more than 5 millimeter, you call it as mydriasis. and if it is less than 3 millimeter or 2 millimeter or less, you can call it as a miosis. So, mydriasis is pupillary dilation and the miosis pupillary constriction. Now, let us see how the pupillary dilatation. The pupillary dilatation, as I already told you, it is via the sympathetics. So, from where the sympathetic arise? The sympathetic arise from the hypothalamus. It descends down. So, you can see it is coming down. It reaches the cervical cord, the intermediolateral horns of the C8T1. They are the ciliospinal center of buds. So, this is the place where this is the first order neuron. First order neuron starts from hypothalamus. It goes to C8T1, T2, and from there the second order neuron from the intermediolateral horn. It goes via the cervical, the sympathetic chain, that is the parasympathetic chain is there. So, not the parasympathetic, the paravertebral chain is there. It does not relay there. It goes up and relay in the superior cervical ganglion. So, this is the second order neuron. So, second order neuron is from the intermediolateral horn passing through the paravertebral chain, and then it relays in the superior cervical ganglion. From the superior cervical ganglion, the fibers are passing through the internal carotid artery, and it reaches the branch of fifth nerve, the long ciliary nerve. So, through the long ciliary nerve, it supplies the pupillary dilator fibers. So, there are three order neurons. First order hypothalamus to the ciliospinal center of buds. Second order is from the ciliospinal center to the superior cervical ganglion, and the third order is from the, it is important when you talk about the Horner syndrome, that is disorders of the sympathetic system. Now, you can watch how the light reflex is done. Stand on the side, ask the patient to look straight, keep a paper in between the eyes, throw the light to one eye, examine the direct reflex, examine the concentric reflex. And you should also check for the Marcus-Kern phenomena or Marcus-Kern pupil. Throw the light to one eye, switch over to the other eye at an interval of around 1 second, and watch for the maintenance of constriction of the pupil. The inability of the pupil to maintain the contraction, or the contracted pupil starts dilating in the presence of light, that is called RAPD. You can watch the video on Marcus-Kern pupil to see the details. So, this is called the swinging flash test, and it is to detect the optic nerve dysfunction. In the next video, we will be discussing the common pupillary abnormalities and what are the relevance of these. Hope this was useful to you, and we will see next week. Thank you.